Hi, I'm Dr. Lavanya from One Family Pediatrics. Congratulations on your pregnancy. We're super excited for you and have created a few videos to help you feel better prepared before this baby arrives. So the first video that we're going to talk about today is what to buy for your baby. So take a look, let us know what you think, and enjoy. The first thing we will talk about is diapers and wipes. You will buy tons of these within your baby's first years. Whether you get disposable or cloth diapers, that is up to you. They each have their pros and cons. If you decide to get cloth diapers, make sure you get enough to last you 2 to 3 days. You'll probably go through about 8 to 10 changes in a 24-hour period. If you're going to get disposable diapers, I recommend a case of newborn sizes to start. Whenever you buy diapers, keep the receipt in case your baby outgrows them too fast. This way you can exchange them easily for a different size. Sensitive diapers and sensitive unscented wipes are the best way to go for those sensitive bottoms. Brand preference will come with experience, although I don't recommend any particular one. Now let's discuss how the baby will be traveling by car and how they will be sleeping. Car seats come in many forms. There are ones that grow with the baby and can transition from an infant car seat all the way into a booster seat. There are individual infant seats that can click directly into the stroller or transform directly into a stroller. Always look at safety ratings before making the purchase. The car seat lady has tons of great information for choosing the right one for your family. Also, about 60% of car seats are installed incorrectly. So if you're not sure, take your car to a child safety seat inspection station. You can find one close to you by going to seatcheck.org. Never let your baby fall asleep in an uninstalled car seat. Putting a car seat on the ground changes the angle of position for the baby. This can lead to blocking of the airway. As far as safe sleep environments go, it is very important that your baby be placed in a crib or bassinet on a flat surface with no blankets, pillows, stuffed animals, mesh guards, or other materials in the sleep environment. The baby should be placed on their back to avoid sudden infant death syndrome. It is recommended that you place the crib or bassinet in your room for the first 6 to 12 months of life. Depending on the season that your baby will be born, short sleeves and long sleeve onesies can be very helpful. Built-in hand covers are amazing because they keep those sharp nails from scratching cute little faces. I have found that mittens never stay on. If it's summertime and too hot for the long sleeve onesies, socks stay on hands a little bit better. You'll want to have a burp cloth on hand when feeding your baby. If they are anything like my first one, then you may need burp blankets. Speaking of blankets, receiving blankets are great for wrapping your baby up. Just make sure not to swaddle their hips too tight when they are sleeping. Sleep deprivation and unbuttoning baby clothes can be torturous at night. Gender-neutral baby gowns are a lifesaver during this time. They can cut your diaper changing time significantly, so check those out. Use unscented detergents when washing clothes. You don't have to wash your clothes separately from the baby's. I also recommend using unscented baby soap when giving them baths. This will help prevent rashes associated with sensitive skin. Baths do not have to be given every day. For the peely skin, you can use Vaseline, pure shea butter, or other moisturizers that have simple ingredients. Again, try to keep this unscented as well. You can even use Vaseline on the diaper area to prevent rashes. When breastfeeding, you won't need to buy too many supplies. Keep emergency bottles available with size preemie nipples. This will mimic the flow of breast milk. For manual hand pumps, the Haka pump is amazing. If you plan on going back to work, you will want to invest in an electric pump. Insurance companies will pay for it, but some require a prescription from your physician, and it may need to be ordered online. This can take several weeks, so find out in advance what the procedure is for having your insurance company pay for the pump. Rarely, formula may be needed for your baby. In this situation, you would need a set of 4-ounce bottles with stage 0 or 1 nipples, along with the formula of your choice. Now, what should go into a baby first aid kit? I recommend a rectal digital thermometer for most accuracy. These are usually designed to have a safety stop so that the end does not get inserted too deep. Keep an emery board and baby nail clippers in your kit. For the first 1 to 2 months, only file the nails instead of cutting them. Baby nails are very soft and you don't want to cause a tear in the skin. Have a bulb suction available to clear up spit ups, but avoid using it excessively to clear out the nose, because this can cause trauma and result in a nosebleed. For medications, you should keep infant Tylenol and zinc oxide butt paste. Remember, call your pediatrician if your baby's temperature is above 100 degrees. Last but not least, don't forget to get your CPR training completed before the baby arrives. CPR training can be completed by your local hospital, American Red Cross, or our office. If you would like our office to set you up with training, please give us a call. Okay, well, we hope that was pretty informative. Our next topic that we're going to discuss is how to prepare your home for the new baby. So stay tuned.